Audio 20, Unit 5, Question 12.
In bed 1 we have Melahat. She's 76 years old and Kadir, her husband, is her next of kin. Her daughter brought her into the emergency room yesterday. She presented with breathing difficulties. She has a medical history of type 2 diabetes. She has no known allergies, and she's on multiple medications. She is on a diabetic diet, but has very poor compliance. She tells me she eats sweets and chocolate in secret. She smokes a full packet of cigarettes every day. Last night she slept for short periods. Today she needs 2 reviews. First, we'd better have a consultation with the respiratory nurse to assess her breathing difficulties. Second, we had better liaise with the diabetes nurse about her care plan. Somebody has to change her leg dressings. Could you do that, Maria? And she has to have a chest X-ray, so could you arrange that with the radiology department, Melanie? I have to chase up the report on her sputum sample. That's all for now. Thank you all very much.
Audio 21, Unit 5, Questions 21 and 22.
Oh, excuse me, Dr. Mayhew. Can I have a quick chat with you about a new patient who came in by ambulance this morning?
Yes, of course.
Sam Carter is 62. He presented with a severe cough and rapid onset shortness of breath.
How is he now?
He was stable for a while, but now he's developed right-sided chest pain.
Any medical history?
He's generally in good health, on no medications. And he's a non-smoker. On examination, his heart rate was 112. His blood tests show an elevated white cell count. Since admission, he's developed a right-sided chest pain.
It sounds like it might be pneumonia.
Yes, that's what I was worried about.
Repeat his blood tests. You have to get him to radiology for a new chest X-ray, and start him on antibiotics as per the guidelines.
Thank you, Dr. Mayhew. I'll arrange that right away.
I'll come and have a look at him later.
Audio 22, Unit 5, Questions 24 and 26.
Mrs. Cora is also very stressed and anxious, doctor. She's afraid.
Afraid?
Yes, she's afraid of dying. She's mentioned it several times to my team. She's also very worried about her family's future.
A lot of our end-of-life patients worry about their families.
I agree, but she feels very responsible for them financially. Her grandson has Down syndrome and she pays someone to take care of him, so that her daughter can go to work. Financially, it's going to be extremely difficult for them if the daughter can't work. I think this is adding to her anxiety.
I understand all that, Rashad, but we have to treat the patient's acute physical symptoms first. For me, that's our priority right now.
With respect, Dr. Carvello, from a holistic care perspective, we need to treat the physical and psychological symptoms together. They affect each other. I can understand how you feel, doctor.
Good.
But I think we both agree that her end-of-life experience should be as comfortable as possible.
Right.
So, that means we need to take care of her physical as well as her psychological health at the same time. I think it's really important for the psychologist to review her as soon as possible. Maybe I could call the duty psychologist and ask him to come and review her in an hour, after you've seen her. Does that sound okay to you?
Well, yes, okay. I guess so.
Audio 23, Unit 5, Question 28.
Mrs. Cora has been admitted to the emergency department 3 times this month.
Yes, I saw that in her notes. Who looked after her the last time she was admitted?
One of the junior nurses, Ahmed.
A junior? Why was a junior nurse looking after a patient with such complex issues?
Nurse Ahmed is a junior, and he's very good. He builds great connections with the patients.
Well, if he's so good, why did the patient come back again 4 days later?
The previous readmissions for this patient also happened very quickly. And as far as Ahmed is concerned, he did everything correctly. I checked the patient's notes myself. He followed all the right procedures and protocols.
I'm sorry, but it's just too much responsibility for a junior nurse. Please can you ask another nurse to take care of her today? Junior nurses just don't have the knowledge or experience to treat patients like Mrs. Cora.